to call the meeting to order. Can we do a roll call, please?
Chris Brune.
Here.
Ray Lapinus.
Here.
Connie Machini.
Here.
Carolyn Schofield. Lindsay Keisman.
Here. Carolyn is joining us on the conference call, so I do need a motion to allow her to join our meeting virtually. She's away for work reasons.
I'll make a motion to accept the call.
Okay, second, please.
I'll second.
All right, all in favor? Aye. Any opposed? Okay. Carolyn, welcome to our meeting.
Thank you very much.
All right. Is there any public comment? Okay, seeing none, I will move to the approval of the minutes of the March 18th, 2025 Finance and Audit meeting. Can I have a motion?
I'll make the motion to approve.
Okay, Ray makes a motion. And a
I'll second it.
Connie seconds. Any discussion? Seeing none. Bridget, are you doing roll call for her or just an all in favor is fine? Okay. Okay. All in favor of the approval of the March 18th, 2025 Finance and Audit meeting minutes? Say aye. Aye. Carolyn, can I get your voice vote?
Yeah, can you hear me?
Okay, awesome. Any opposed? Great, minutes approved.
We know.
All right, moving on. Is she saying something?
Caroline, could you repeat yourself?
Carolyn, I can't hear what you're saying.
Okay.
Or,
Sorry, can you hear
no.
me now?
Yes, much better.
Okay, I will for voice votes. I'll go like this, for votes, but otherwise I'll put you so I can put you on mute better.
Okay.
Okay, sorry.
No problem. Thanks, Carolyn. All right, moving on to 4A, Finance Report for the period ending March 31st, 2025. Mel?
Okay, not much to report out on the board reports. They're pretty normal. We've got our normal interest income and payroll that didn't quite get posted yet on the reports. On the admin report, just a few things I wanted to point out. One was, I guess the only thing I really wanted to point out was snow removal. We had some delay in processing it. That's why it looks like we had a ton of snow removal in March when really we didn't. Those were just prior December, January bills we had some issues with. And then the only other thing, the office furniture, was the new chairs, which you can see in the back of the room here that we got in. And those were the only bigger expenses I wanted to point out. Revenue or expense report, things are processing pretty much as expected. Everybody's where they should be, so nothing to report out there. And also fee for service, same. Nothing unusual to report. So unless anybody had any questions, that's all I had on the finance report.
Any questions? No? Okay, let's move on to 4B, Opioid Fund Finance Report for period ending March 31st, 2025.
All right. Opioid reports, just the two normal payments have been processing. We do have an update. Mathers Recovery did receive their approval from the state to do their mobile unit, so that's going to be starting up, I think, in April. Yeah, so we will see a payment for them in April. And then New Directions, we finalized the capital agreement with them, so that one-time payment should be coming out soon as well. But otherwise, nothing else to report on that report.
Any follow-up questions? Seeing none, we'll move on to old business. 5A, FY26 personnel change regarding the training assistant. So I did want to add in a little bit of feedback. This is the position that they're looking to add, the moving up from 30 hours to 37.5 hours. Connie and I have had some conversations with staff, and Connie has recently met with the marketing person that we've contracted with, and looking into next year, one of the points of feedback regarding this position is that there may be an opportunity to move some of our contract dollars that we spend about $25,000 for a marketing person each month, and that with a small budget to have a person come in and train an on-site staff member one time to manage a lot of our social media marketing and other print materials, that might be a better use of overall spend. So as we're discussing this training assistant position, I just wanted to add that information at this point. So the marketing budget we have in FY26 includes $25,000. They're thinking a little bit more like $5,000 would be the marketing line item. And then we would include the additional dollars for the training assistant, which $9,552.67 would be added. So I wanted to see if there was any feedback that we could bring back to the full board or discussion around this. All right, Connie?
I just wanted to say, if you look at the numbers, for 9,000, we'd probably be saving 20, and teaching our person all the social media. Both Lindsay and I talked on our way to Springfield. Springfield, that, we should do it in-house. It would be more advantageous that we get into social marketing a little bit more. So I'm just reiterating what she's saying.
Chris?
We would still need some separate market, like we have the billboard, for instance, like on 31, when we do our town hall and stuff like that. So this isn't going to cover all of our marketing costs, right? It's just going to cover some of the contractual fees that we pay to a consultant right now.
Yeah, so staff recommendation was to move it from 25,000 to 5,000, which would account, I think about 20 to 25% of that 5,000 would go towards bringing in the external consultant to train our staff, and would leave us with, $4,000-ish, $3,500 in actual external marketing spend for things like radio ads and whatever staff
Constant
would like.
contact costs money, and okay.
Yeah.
So Constant Contact is actually in our software budget, and that we just use internally. Right now, a lot of what we're spending our marketing money on is radio ads, which we're not really sure how effective those have been, and like the Northwest Herald inserts, those sorts of things. And there was also talk about like a podcast, which, we had budgeted for, but we're not going to pursue that at all. So it would just be kind of a switch from more print media to more social media is kind of what we're looking, print and radio to social media is kind of the direction it would be changing.
And as it relates to this training assistant, the idea, my understanding is she's already the one that's designing our graphics and is already involved in all this. So the additional hours would be, something that she could spend on all the things she's already doing in addition to some of these things that we're sort of contracting out for. So is there any further discussion, concerns about making a recommendation to the full board to approve the training assistant position? Okay.
Lindsay, can I add something?
Yeah, of course. Carolyn?
Is this for next year's budget that we're doing this?
Yes, it's for FY26.
Okay, because I'm good having the discussion as we move forward in that budget. And in line with what you were just saying. So, okay, I just wanted to double check on that, make sure it was for the next year, not current.
Correct.
Okay, thanks.
Yeah, no problem. Okay, seeing no further discussion, I'd like to move on to the deputy director position that we all received in our last meeting. After Connie has spoken with staff and we've all spoken together, there is some feedback that this position would be best to potentially consider holding off on, given that we are in search for a new executive director. But I did want to open this up for discussion to see if anybody has any more feedback or if there's more you'd like to say about this, Connie.
Well, I was against it, I told you, at the last board meeting, and I think right now we're in search of an executive director. This needs to be put on hold. That's my opinion. Should be just put on hold. I mean, you don't look for two top, to my opinion, two top people all at once.
I will share my opinion, which once again was that I do like the idea of having, a second in command kind of position, but I also don't think that this is the right time and that we would want a new executive director to be involved in the hiring of this if we ever thought this was a direction we wanted to move forward to in the future. So given everything going on, I do not think it's the right timing whatsoever. And Chris?
Yeah, I also think it would not be the right timing, but I think that, reviewing the scope of duties of the executive director, I could see that there may come, the need for this may arise, and it may not be the case that we want to wait a full fiscal year before taking this on again. And I wonder if we will consider putting the budget to fund this position to the side with the understanding that we can revisit this and reallocate that money to, to services if we decide not to proceed with hiring partway through the year after we have an executive director in place and onboarded. Does that make sense?
I think so. So you're saying put it in the budget with no intention of necessarily
Not hiring now.
not hiring now,
But
but
have the
potentially halfway through the year,
opportunity,
have
yeah.
the funds available to make
Yeah.
that decision?
Yeah.
Okay. Connie?
I'm looking at other mental health board and how they staff them. I have talked to the people in Champaign County, which is bigger than us. Winnebago County, I made contact with them. So basically, I just want you to know, we can still put it in the budget, but they don't have what's it called? A deputy director. They do not have this, and they're bigger than our agency. And I will be bringing it to the board's attention, all these different charts.
I think it's possible that the conversation around kind of holding dollars for a position and when we would release those dollars and when a decision would be made about that would all have to be included in, a recommendation like that. One of the things I will say, having participated in working with our three awesome managers on figuring out this transition is we do have a very capable management team, and I do think we will have considerably better information as to organization and capabilities of the team that we already have as we onboard a new executive director. With that said, I think the likelihood that we're going to, from a timeline perspective, bring on a new executive director who will have the capacity to really fully assess, the need of a deputy director position, I'm questioning if that is a determination that that executive director could even try to make within the time frame necessary. And thinking about what we're doing now, it's April, we're making recommendations for FY26. If we hire an executive director, if they want to give this feedback to potentially put into FY27, they'd have to know that already by this time next year, and we don't even have them hired. So my perspective on that is I like the spirit of the idea, but I also just question if it's even a realistic time frame to expect there to be enough information to know if it's warranted. And if it's not, I'd rather not hold up those dollars for FY26, where we could earmark them somewhere else. Does anybody else have any thoughts or feedback? Carolyn?
Yeah, Lindsay, I totally agree with you. I think it's not that it's not relevant for future discussion, but I think for this budget year, it's not realistic. Someone would take time to get their footing and understand the organization, and then, not saying it couldn't be a future discussion, but I just think, for FY26, it's not necessary.
Okay, thank you.
Do you need a motion?
I was going to say, I think we should do a motion on this one so that we can make a full recommendation.
I make a motion that we do not include the deputy director in the next year's budget.
Okay, do I have a second?
Next year's or this year's? Well, we're in this year. Next year is what we're talking about, yeah.
Is there a second?
I'll second.
Okay.
I'll second,
Ray seconded. Any further discussion? Okay,
Clarifying, she motions not to recommend, correct?
yes.
All right.
Okay.
She motioned not to recommend that we
Put it in
do the deputy director position in FY '26. Okay, seeing no further discussion. Carolyn will be voting on our pads, and then we'll do a voice vote for you. Okay, Carolyn, can you vote, please?
yes, I'm a yes, so.
Okay, thank you. Okay, motion passes. All right, moving on to 5C, the FY '26 draft budget. There's a number of items that I'd like to get feedback from the board on, so I'm going to kind of briefly do an overview of those, and then I'd like to have some open discussion so that we can get feedback and direction to give to the full board. So I know that the draft budget was sent out to everybody, and so far there haven't been any emailed questions, but I also know we're having some email problems. So hopefully most of you have been able to review the FY '26 draft budget. So a couple of items relating to personnel changes were that deputy director and that training assistant position, which we've just talked about. In addition, we need to, and I'll go back through these, but make some decisions on the bathroom remodel project. There's been conversation about whether or not we should continue our CARF accreditation. In addition, do we want to reserve budget for board members to attend NatCon? And then there were some new mental health board managed programs, which was a disaster coordinator, and then also dollars for the IRIS program implementation and whether or not we want to keep those in the budget. And then also, historically, we would keep back a portion of our dollars for a mid-year funding allocation. And we do need to make a decision whether or not we would like to withhold a certain amount, what that would be, or if we'd like to put the entire pool in and not have those dollars. So I'm going to take this one topic at a time just to keep it a little bit organized. So I'd like to see if anybody has some feedback on the bathroom remodeling project for FY '26's budget. All right, Connie?
Has everybody around this table seen the bathroom that we're talking about remodeling? I'm just asking.
I have not.
Yeah, you should probably go up and see it because it's in pretty bad shape. It's in the old building. This is the new building. That's all I'm throwing out. You need to see it before you can, I think, vote on it. That's my opinion.
I know in previous meetings, I had said that when it came to our building, I really thought that we should lean on our Buildings and Grounds Committee to make the recommendations for what needed to be included in FY '26. And I know we've got two members that I think are in that committee. Has there been any further discussion on this? Because the last I've heard, it's still up in the air. And we don't have a lot of time to keep it still up in the air as far as the budget. Ray?
Lindsay, I wanted to give a little input too, so just let me know when.
Okay, one moment. Ray's going to have the floor.
Okay.
I was going to say, I wasn't supportive of the bathroom remodel. I think that it's quite expensive and excessive, and so I still want to see more detail. Maybe I should go check it out. But for the dollar amounts, it's almost like you buy a Scylla home for that.
Yeah. Carolyn?
Do you know the status that, if there were any grants that were filed for potential grants on that, or if we might know the status of them if they were?
There were.
Yeah, I'll ask Bridget to make a comment on that.
Yeah, we were able to get one grant filed. One we did not qualify for. The one grant we applied for was for $30,000. So that is the only grant we've applied for so far.
Okay.
And we don't have a
And we
status of where
haven't
it's at.
really, and we didn't talk about it anymore at Building and Grounds than we have had this conversation. I mean, I think it's definitely something we need to do. It's just that, what's that dollar amount going to be, I think is what we were waiting on.
One of the feedback points I had relating to the grants is, oftentimes when you receive a grant, if you get a partial award, they're going to ask where the remaining dollars come from. And so as we are applying for grants in FY26, one of my concerns would be that if we don't put something in the budget and we do get a grant, it may only partially fund what we need to do. And I would, hate for us to miss out on grant opportunities because we don't have the dollars in the budget. So I personally had thought that putting it into our FY26 budget and then, allowing staff to have more time to look at grants, write for grants, hear back from grants. It's an opportunity if we don't need to kind of do the bathroom to put it back in our mid-year funding cycle, perhaps. But I don't know if we would just need to move those dollars and have a motion to move those dollars at that time. That's just a point of feedback that I have, is if it's not in there, we can't do it. Any further discussion? Okay, Chris?
I mean, I guess I'd like to see the bids for the project, like current bids, because it's also the case that costs are dynamic. And so making sure we have real updated proposals, like in live time, that we can look over and review might help us to make that decision, because I haven't seen anything like that yet.
Okay. Bridget, can you give us a date on the next Buildings and Grounds Committee meeting?
We don't have one scheduled right now. And can I respond to Chris?
Sure.
As far as current bids, the problem is that we don't really have blueprints or what we're actually doing. So what we did, what we put out was an estimate of what we'd possibly do. And so it was an overall estimate of taking an area and turning it into 4 separate bathrooms. And the reason why that increased the price so much was the concern for the fire suppression. So in the event that we did move forward with that, the board decided to go forward with it, the recommendation that we had talked about was to get get an architect first and then have them then bid on that. Because I'm not confident that that's an accurate bid, and I'm not sure that we can get an accurate bid without having an architect first tell us what's necessary. I don't know that we necessarily need to move the fire suppression. The other option which was discussed at some point in time was possibly just updating the bathrooms rather than doing a complete remodel. The idea of doing the complete remodel was to have 4 gender-neutral bathrooms rather than having 2 sections that were remodeled. So if that offers anything. As far as getting updated bids, we can do it. The problem, again, is that you have contractors in probably their busiest season that are going to have a hard time giving you an estimate for something that they really don't have an actual blueprint of what they're going to do. I don't know how to explain that better. So they don't have the architects, and so it was really all just based on estimates. And they're old, so I agree with you, Chris. It could go up, it could go down. It's a difficult situation. And we realized that too when talking with the grant, applying for grants, because one of the grants we needed to have a lot more information for, and permits and all of this stuff. We weren't that far into this project yet. We were not far enough into it to qualify for that. So kind of putting the cart before the horse.
Bridget, do you have any idea of the approximate budget to bring in an architect?
What did, I don't know offhand. I can get an estimate. That might be a good way to,
I think that would
Go
be
next.
a direction that would make sense.
Yes.
Because we're not going to be able to get grants, we're not going to be able to do that.
Right.
So, and once again, if we're that far behind, then the likelihood of doing this in FY '26 is not very great, so.
well, right. And it's hard to move forward without the direction of where you want to go. So I don't want to move forward with anything without your direction, but it seems to make the most sense to have an architect first. I can try estimates from architects and then see where we go.
I think speaking not as buildings and grounds, but as a finance committee, we need better numbers and,
Absolutely.
to know what we're going to do. And if we don't have better numbers, I don't want to take those dollars and set them aside. As Ray said, it's quite a large sum of money to reserve when we don't even know what's happening. So, yeah.
Agreed.
Any further discussion on this topic? And then feedback I think we're getting from the board is that, a discussion about getting the costs for an architect would then inform any future decisions regarding this. And we would probably not recommend that we tie up those dollars in FY '26 unless new information came to light. Okay.
I think it's probably, an architect is a good idea to see what we're talking about. I agree with Chris. I think that, and I would estimate from doing a lot of remodeling, you're talking maybe about $5,000 for a total architect drawing and everything.
Okay. And do we have the dollars in FY '25's budget to get an architect to quote or to pay for that? What does that look like? I am all. Okay, Mel?
If we're talking $5,000, yes. If we're talking $20,000, no. So it all depends on what the cost would be to get the
Okay.
architect plans.
Cheaper.
I'm joking.
It sounds like in general, we just need better information.
Absolutely. Anything-
So
Just hit your button.
I think if we could get staff to investigate that and then report back, that would be ideal. Linda?
She'd like to say
Yeah.
something.
You had, I know I'm not on this committee, but I would like to say, if the bathrooms are really in bad shape, which we don't know, that we should at least consider setting money aside for some updates, even if we can't do a full remodel, if it's that bad.
It's, my opinion, it's not real bad, but it needs some updating at least. I mean, it's functional.
I think there is a difference between functional and not embarrassing, yeah. I mean, clearly, I think that if we had a non-functional bathroom, we'd be having a different conversation than we're having right now. So as far as the budget, perhaps this is a conversation that can be brought up at our next, all board meeting and give, Bridget some idea to get an estimate on what it would even cost, and that could give us some direction and hopefully enough time frame to still have this conversation at the full board meeting regarding this particular topic.
And I would think if you want to see it, after our board meeting, maybe Bridget could take you back and show it to you real briefly.
Do a field trip in between the meetings.
Little field trip.
Okay. All right, so unless there's further discussion, I think what we're going to do is we'll move this forward to not tonight's full board meeting, but the next full board meeting, hopefully with some updates on basic information that could influence direction we would give to our FY '26 budget regarding the bathroom remodel. I'd like to talk about the CARF accreditation. Connie, would you like to share a little bit about your thoughts on this process?
Yeah, I've often wondered why we're CARF accredited, because we don't provide services. And going down to Springfield and talking to other agencies, they are not CARF accredited. And we spend about $10,000 to be CARF accredited. and lots and lots and lots of staff time. And my opinion is, why? I just, that's one thing I think we could save money on and give it back to the agencies.
And just to be clear, CARF is a fee that we pay every third year for the $10,000. And after speaking with staff, it's really the amount of time that they spend. And I know that while the philosophies around CARF are fantastic and all the policies and work that was done to achieve CARF accreditation can continue without the formal CARF accreditation. So the spirit of what they do doesn't need to sort of stop in our day-to-day best practices. But CARF accreditation is, as we're looking at any opportunity to minimize and go back to the basics, it feels like a discussion point we should have on whether or not any board members feels like there's meaningful value in continuing with the accreditation. Chris?
So I've been involved in like formal accreditation processes for probably 12, 13 years. And I've seen entities go from an accredited status to, we'll just maintain high standards on our own and not pay for the process and engage in the, like strenuous efforts to do that. And what tends to happen is that they gradually drift away from those particular standards because there is no external incentive to do that. Now, I don't necessarily object to the idea of discontinuing the accreditation process, but also I want to put out there that that creates some risk for drift from accreditation standards, and that we should probably impose some form of internal review if we're going to do that, to ensure that we're continuing to achieve the same high standards we have now.
I'd like to, CARF accreditation is for rehab facilities like Pioneer Center, okay, and they have to be accredited because they want state money, like DOORS money, or they want federal dollars and stuff like that. But the reason I thought we could not have to pay CARF is that we are not running programs. We're a funder, basically. And I agree with you as far as keeping high standards, but at this time, I think it's better to take that money and staff time and put it elsewhere. That's all. Because we're getting, if we decide, I think they're revving up to do the CARF accreditation. So.
Ray?
What is the timeline for the CARF accreditation? Is it this coming year?
We got 3
Yes.
years and it's this year.
Being one that's gone through a CARF accreditation and with the new staffing and such, it's going to be a burden on the new executive director and the staff here. And I would recommend, for that reason, not go forward with it.
I'd like to ask a question to Karen, who led our CARF accreditation before. If we choose not to move forward, do you know the process for re-upping in the future?
That's a good question. I have not looked into that. I couldn't answer that without looking further into it. I don't know if there would be added expenses if we have a lapse. I know typically when an organization wants to be accredited initially, they need to have kind of a pre-certification review, so it might lead to that, but I'd really have to look into it to give you an actual answer on it.
How much time do you spend on CARF, Karen? That's my question. Approximately.
Well, again, we have high standards across our sectors. A lot of it's for CARF, but also just we want to hold ourselves to high standards. During a CARF accreditation year, yes, there's a lot more work going into it. It's doing the application, it's providing the binders for the reviewers, it's scheduling the reviews with our providers, and then it's also, they really appreciate if we can upload documents too. So it is quite a time burden. Thankfully, it's only once every 3 months or 3 years for that particular piece. But in general, we do have quite a bit of work anyway, just trying to maintain those standards.
perhaps some direction to get that, question answered could give us, better feedback to talk about at the full board meeting, because really, as we start to discuss things, we're coming across, more questions we want answers to, because once again, if re-upping is something we want to do in the future and it costs triple the amount, that it could influence a decision, so. Any further discussion?
I sort of want to answer that question about having a gap. They would look at it as a new application, I'm sure. So if you have the forms, you'd probably be just updating them. I'm just saying, they'd look at it as a new application if you decide you don't want it.
Okay. Any other direction we want to give to staff and things to investigate regarding this that would help us answer this at a next board meeting?
Actually,
I can, Ray?
my whole philosophy is if it's not required, and I don't really see grants requiring it and such, there's a cost benefit. Again, it's money that we're setting aside that we could be providing to our providers and such, so I would strenuously say not to put the poor staff through that.
Linda, you have a comment?
I have a question. You were both down in Springfield. Do the other agencies that are functioning in the same way that we are have a different accreditation for some kind of financial, okay, they do not. All right.
None of the ones that we talked to did.
The large agencies, no.
Yeah.
I don't know about all the townships, because there's a lot of township mental health boards.
I would suspect they wouldn't, though, just
Right.
based on their size, quite honestly, yeah. Okay. And then just real quick feedback, NatCon is a conference that we've always set dollars aside for, and going back to the spirit of back to the basics, is this something that people value? I'd love to hear from, I do believe Connie and Ray have gone to NatCon in the past, just to understand if we think it's something we want to continue to earmark dollars for.
I enjoy it because it's national. It's not just, you've got people from Europe and all over, and it's a good conference to learn what's going on federally and locally, and I mean, I enjoy it. It's not a necessity. This year, I should probably say, Ray and I were slated to go, and we are not going because of health reasons.
I would recommend NatCon for new board members. My first NatCon was Las Vegas, which was excellent. The last one I did 2 years ago in Los Angeles, it wasn't as, expansive educationally to me. So I think the NatCon is good for a new board member or someone that's not attended. But would I personally go again now? Probably not. Save the money again.
Does anybody else have any thoughts or feedback on NatCon? I have not attended NatCon. For me, in the spirit of back to the basics, if it's not necessary, I wouldn't do that. And I do think you don't always have board members that have the time capacity to go to, a national location. So I would be in favor of cutting that expense.
I would not be. And not NatCom, I'm not saying that, but I think it's important that we as a board keep up to date with conferences. I'm not saying it has to be NatCom, but to do away with all training of board members, I think is a mistake. Whether they're new, old, whatever, I think it's a mistake. And I'm not saying it has to be NatCom.
Carolyn? Yeah, Oh, I don't know what happened there.
There you go.
Yeah.
And I'll kind of echo what Connie said. I don't think it has to be that one, but I do find value in attending conferences and working with peer boards and finding out what others are doing. I mean, I do think money in a budget for, to some extent, for board members throughout the year to educate themselves and find out what the others are doing. There's great value in that.
Okay. Any other feedback? I don't have it pulled up, sorry, but what did we reserve for NatCon in particular, Mel? 10,000? And is that based on previous spending?
So it's $1,000 per board member to register them for the conference, and that's in the training budget. And then we typically see about $2,500 to $3,000 per board member for their actual travel expenses, hotel, meals, et cetera. So right now, I've got $14,000 between two budget lines.
Okay.
Just one last thing I want to say is that if NatCom came to Chicago, and it has been in Chicago, I think to just say no NatCom or no training would be a mistake for this board. That's what I think. I mean, I think that traveling and all that expense is an expense, but to just say no NatCom, and I think they are planning to come back to Chicago, it would be well worth it for us to go. So it should be something.
And just so I'm understanding correctly, you're marking $10,000 because there's 9 board members, or?
In the past, we've done 4 people, up to 4 people going.
Okay.
Sometimes it's a mix of board members and staff, sometimes it's all board members.
And if we were to reduce that to 2, what would that bring the budget forecasting down to?
2,000 in staff training, and then 5,000 in travel
Okay.
expense.
I'm in favor personally of continuing for education, but I'm not sure that we need to earmark that, for more than 2 people per year worth of large travel expense, given also Connie and I just went to ACMI, which doesn't require a plane ride and anything like that, and they come to Schaumburg once a year. So I think there's some opportunities locally too that would be significantly more cost effective, so.
Can you leave NatCom, my question is this to you, can you leave NatCom off and just do it board training? I mean, that there's a line item for board training? Doesn't have to be a big one, but it should be for, if Linda saw, she saw something that was going on in DeKalb, that she could go to that conference, or, I mean, there should be something for board training, that's all.
Do you want to answer that, Mel?
We can definitely, we have a staff/board training line already, but those funds, we usually earmark just for NatCon, but we could, do $2,000 in there in addition to the, if I did, let me see here. So if we took out NatCon, there would still be $6,000 in training available to staff or board members if we took out that $4,000, or we could reduce it by $2,000 and still have $8,000. So you can, there's definitely funds available, even if we take out NatCon, that a board member can go to a $300 conference here, or, a training, or.
Any further discussion, or would somebody like to make a suggested motion for a budget that we would set for board training? Anyone? Yeah, okay, great. Chris?
I personally am probably not ever going to be able to go to NatCon because the timing of it is just, it co-occurs with the end of the semester, which is not feasible for me. But we are going to be having new board members, and based on, the conversations I've heard about it being a valuable training opportunity, it would be valuable to reserve sufficient funds to send at least somebody to it, if not all the people to it, if it's closer. And I don't think I've gone to a conference that's cost less than $1,000. Like I submitted reimbursement on $1,700 this morning for a conference. And if you have to fly and you need accommodations and it's a conference hotel, that it adds up. It's costly. So I agree with the idea that we can reduce the budget, but if we're going to try and reserve the opportunity to make a decision about sending somebody to this particular training opportunity, then I'd suggest we don't reduce it too much. So if you're saying it's $10,000 and that's 4 people, and we want to send 2, then we might want to save 5 for that.
Okay. It sounds like currently it's spread between a couple of different accounts, and I think the spirit of that discussion or comment would be it's a value, but could we reduce it slightly, whatever line item way that makes sense for our budget?
So basically reduce it from 4 to 2 is kind of what I'm hearing.
Yes. And increase the flexibility so it's not just NatCon.
Right.
So, yeah. Okay, perfect. Any further discussion? Okay. Moving on, there was some recommendations for a disaster coordinator position and an IRIS program implementation line item in here. So we wanted to get some feedback on that. So a little history that I'm aware of. So IRIS program is the program that will allow for agencies to refer to one another and try to increase service connection, referral, and increase reporting. And we were going to have some funds in order to implement that program and bring it in. And then the disaster coordinator, there was money set aside to bring somebody in to craft a disaster plan that we would use. So this was like a consultant that was going to come in, or contractor dollars that were going to come in to help with crafting a larger plan for our county. Our current staff, I think, don't quite have a full conceptualization of what that was going to look like, and without that direction from our previous executive director, we're kind of questioning whether or not we wanted to keep it in the FY26 budget. So I wanted to open up both of those for discussion. Carolyn?
Do you know if it's required?
The disaster coordinator? Not to my knowledge. Would any staff?
Okay, then I mean, I think your staff is small enough. I mean, I don't see a reason for it unless it was like a requirement.
It was part of the strategic plan, I understand.
Okay.
So
all
that's
right.
what it was geared towards.
Okay, all right, thanks. And then, I'm sorry, what was the first one, because I had a comment.
The IRIS program
Oh, yeah, and,
implementation?
I'd be curious to get more information on that one, because I, in my day job, split counties, and Kane County uses it, and I've heard nothing but good things about it and how valuable it is. So I do think that that would be, I mean, just from what I've heard, I haven't used it, I don't know about it, but I've heard really good feedback about it. So I think that might be worth it.
I can give some personal feedback about IRIS. My businesses also cross into Kane County, and so we are utilizers of the IRIS system. I don't have a bad thing to say about it. But it is like any new program. It requires implementation, staff hours, an expert to set it up, and then it does require kind of the human behavior component of getting everybody in your network to understand how to best use it, best support, one another. So as far as my personal experience, we're kind of hitting a little bit more peak efficiencies in it in Kane County. And I think that it's in alignment with a lot of our strategic initiatives. I think also the reporting capabilities are things that Karen is having to manually receive from our funded agencies that might actually cut down on some of that manual entry. So all around, I think it's a win. So I'd like to see it in there. Chris?
I'm going to go Mike Baber for a second and tell you a story. So in 1991, I worked on a suicide hotline in Seattle, Washington. And we, at that time, that long ago, had a computer-based system where if somebody called in and they needed to see a therapeutic provider, we could schedule them into someone who was accessible to them geographically, would take their form of payment, and we could tell them what time their appointment was in 1991. And it maddens me that we don't have this. And there have been efforts statewide. DCFS crafted Spider, the Behavioral Health Transformation Network has got Beacon, but there's nothing systematic other than Iris. And like you're saying, the people who are using it have grown to depend on it and found it to be, we have a no closed door policy, right? You seek out a service and an agency could provide an appropriate timely referral to get that service at a provider that's able to provide it based on the configuration that the user needs. And I think that us exploring that is well worth our time.
Any further discussion? Amy?
Yes. Is the consideration just for the subscription only, or are there costs for a consultant to help implement? I'd just like to apologize, I'm not on the financial committee, so if I'm not supposed to be asking, but I'd like to just make sure that we're understanding the full scope of what it would take beyond just a software subscription.
I will let Melanie respond to that.
This was, what's in the budget right now is the quote we got for the full implementation, them coming in, setting it up, and so forth. There would be a continuing software, price going forward, but this was for the full implementation.
Okay. Sounds like we have consensus that we'd like to leave the IRIS line item in. Is there any further discussion on the disaster coordinator position? Is anybody in favor of this and would like to comment? Okay, Linda.
There already is our disaster planning agencies in the county, and do they address this at all, or do we know? We wouldn't want to be doing it if it was a duplication of effort.
I don't know the answer to that. I do know that Leah was involved in this. I know there was some discussion at ACMI about a focus on, disaster coordination. But I don't have any best information of sort of what connections she already had to formulate or roll something like this out. My understanding was this was to bring somebody in to have them come up with a full kind of disaster plan for us. So that's what the dollars were for as it pertains to the line items in the budget. Chris?
I think my suggestion would be that we not budget for the disaster plan coordinator this year, but that we instruct our new executive director to explore with our community partners what exactly the resources are that are in place right now and what additional resources might be necessary so that we could scope out what exactly is the need that needs to be filled and what's the person who might be able to do that.
Any further discussion? Okay. Connie?
I just ditto what Chris said. I think that's true.
So I think while we value the concept of this, pushing it out a year, so maybe removing it from FY26 with an idea that it'd be a conversation with our new ED. Okay. Last up for discussions was typically we hold back a certain amount of money for mid-year allocations, and they need some feedback on whether or not we would like to do that. So in this fiscal year, we did that, so we typically earmark a certain amount, and we have, I believe historically, perhaps Ray could give us some better history on that. And the idea would be that we would use those funds for emergencies if they arise, and or put them into a mid-year funding allocation like we're doing this year. Obviously, given our circumstances, everything's up for discussion on whether or not we want to, continue that ritual. So they're looking for some feedback on whether or not we would want to hold back, and if we are going to do that, what amount of dollars we would hold back. Ray?
Melanie, do we have a chart on what's been done historically? I think historically it's been more funds that are not utilized would be just collected. not formally set aside.
I don't have any charts prepared. I could put something together if that's what you'd like. I know last year we originally earmarked 650,000, then when we did the budget revision, we pulled it down to 300,000. And basically, anything you put to the side means your, initial allocation pool is going to be smaller. We also tried during the year to, any unused funds, we pull those back, and anything in the admin budget we could pull back. But, as we're tightening up the admin budget, there's less of those funds that are going to be available at mid-year. But, yeah, I don't know that there was a true set amount every year
Yeah.
or a standard.
Don't worry about a chart on my account, but yeah. Again, I'm the proponent of having as much funds available, especially with our tight budget for funding programs.
Carolyn?
Thanks. I guess I didn't realize that we had a specific one that we held back. I thought we were just going to do those unutilized. Is there a way of doing that in the budget where if we just have at the end of FY '25, whatever wasn't utilized, then we can figure out what that is and put that into the mid-year allocation for the FY '26? Is there any way of doing that?
I believe we would then have to make a request to pull it out of fund balance, but I'll see if Melanie has any more.
Right, I kind of think we got away from that when we've now gotten the position where we're basically going to be using fund balance to sustain our existing funding levels to make up for revenue shortfalls. So I think we kind of got away from that plan.
So we want to put that back into fund balance, so the fund balance will actually sort of increase potentially? So
No,
that
not.
we would utilize less the next year?
So no, I mean, we don't have any, if we don't reserve the dollars now, right, anything towards the end of this year that's not utilized just automatically falls back into fund balance.
Right, I guess that's my question. Are we kind of trying to estimate what that number might be? I mean, I think that's what we were trying to do historically, was estimate that number,
Right.
so then,
And I think at that point, we were planning on, that would be the fund balance we would use in the next year.
Correct.
Whereas now we're using a larger amount of fund balance just to make up for revenue shortfalls. So it would be like pulling in additional money on top of the fund balance we're already using to do the set aside like we had originally talked about.
but then we're always going to have, I mean, historically, we've always had,
Money rolled back, yeah.
right. And so I guess if there's any way to see historically what that could be, I don't have a problem putting that in there, because we'll recoup it at the end of the year, technically. Either that, or you just skip a year and you know what that number is for the next year. I mean, this may be the year we skip it, and then whatever that was, for FY '25, that gets into the FY
27
'27
budget.
year. And so that's what you put in for your mid-year that year. I mean, I don't care which way it goes. It would have to skip 26 in order to do it that way, but then you would know the exact number. Because instead of continually building your fund balance, I know we're taking it from there, but we're also taking it because we have it there right now. We're using it because we know it's there. So this way, it would just kind of keep a even playing field the whole time. So either way is fine with me, but I do think if we want to skip FY '26 and start it in '27, or if we want to estimate it, but I do think it's valuable to have it one way or the other.
I think it's not a problem to do it, to take whatever FY '25's number is and FY '26. It's just a matter of we would have to make a request to move those dollars from fund balance back into that current fiscal year budget, which honestly we would have the time to do because we would have the numbers before we would do a mid-year allocation process. Typically, it just means we have to go and do those steps with the county board. Personally, I think the philosophy around that made sense until we were in this situation where potentially every dollar is crucial. So with that said, I don't like the idea of not having mid-year reserved dollars for a potential problem that arises. I don't think that that is, wise for us to not have access to some sort of funding in case an emergency were to arise. However, I know in the past I have asked Melanie how often we've even had to go into fund balance, and, typically in I think we did a 10-year history, looking back on different, COVID-era issues, Change Healthcare, Medicaid backlog and payments, and never had to actually go back and dip into fund balance because you could go into that fiscal year's dollars and move things around. With that said, I think over the last 2 years, there's been a lot of efforts made to really, really get tight with our administrative budget and with our client services budget, so I don't think we can assume that those funds will always be there. And as we potentially underfund some of our fee-for-service providers, we're going to have a mid-year need, and it's really up to this board to decide what our philosophies are going to be around that. But from a finance committee perspective, it's just, what's the number we hold back? So we can look at, fund balance amounts over maybe the last 3 years to come back to the board if that's something everybody would value. Connie?
Oh, I'm sorry, I did.
No comments. Anybody else have any further comments, questions, or discussion? Okay. Melanie, if you wouldn't mind getting us that information over the last 3 years, maybe that's something that you can share out with the board, and we can, once again, bring that up for further discussion at a future meeting.
Okay.
All right. There's no new business for discussion. So I'm looking for a motion to adjourn. So moved. Okay, a second? Second. Okay, all those in favor?
Aye.
Aye. All right, we are adjourned.